What is going on, guys? Welcome to another episode of the Masculine Health Solutions podcast, where I am joined by the legendary Dr. Cory Torgerson, who's going to basically lay down the law when it comes to male enhancement in a good and healthy way, positive way. And Dr. Cory, first and foremost, how are you? And how'd you get started on this journey?
How you doing, CJ? It's awesome to be on your show. I am fantastic, and male sexual health has been a passion of mine for several years, and really it was just in just a response to just like yourself, a personal journey, and then really listening and good feedback from my patients. And I really feel that male patients are probably some of my very best patients because they have often very realistic expectations, and once you make them happy, they come back and back and back, because we're all the same. Guys care about three basic things. We care about our sex drive, we care about performance, how our penis works, and we care about what it looks like.
100% true, man. And that's honestly, it's kind of what got me started on my journey as well, was just the curiosity factor and the fact that, hey, there's something I could actually do. And in your case, you were talking a little bit off air how, these things kind of led to your journey beginning. But what was that one inciting incident where you're like, okay, I really got to undertake this? And I think there's something to it here. And
Yeah.
obviously for me, I got all that spam crap. And like I said before, and everybody on the show knows, I invested in a lot of that spam, wasted too much money, and that's what didn't work. However, there was some truth behind the extenders and other things I started looking into, nitric oxide and all that. But what was
Yeah.
that inciting incident for you where you're like, hey, there's truth here, let me see what
Yeah.
I can unpack, extrapolate, and what can I bring to the masses in a positive way?
Yeah. I think probably for me, it started with my sex drive. I turned 50 on the weekend, and
What? No, you
and
didn't.
I did it.
Nah, man.
And
Not at all.
so
You look fantastic, man.
thank you. Um, uh, Men are just like women. We go through, in the same way that women go through menopause as they get older, their ovaries in essence start to poop out. They don't make as much estrogen and progesterone. They get symptoms. It's called menopause. As men get older, the same exact process happens where our testicles kind of poop out and they don't make as
Mhm.
much testosterone, and we get symptoms, and it's called andropause. And the problem in the medical community is that it's not really recognized. It's not really actually taught. There's a
Mhm.
range of testosterone, and if you're at the very low end of the range, most family doctors or even endocrinologists will say, "Hey, you're totally fine," and then they'll kind of like say, go away. Most of them don't really have an interest in being able to optimize, and so I found out all about that, and I got optimized in terms of my testosterone because it was low. I was having symptoms, common
Mhm.
symptoms: low sex drive, just feeling tired, fatigued, low concentration, bad sleep, really hard to build muscle, and to lose the weight. And when I was optimized, all that changed. And that really, I started feeling like I did when I was 18. Doing testosterone replacement therapy was a game changer. And sort of started with that. And then I thought, well, what are the other things that make sense for me? And then I really crafted a clinic kind of around that. Again, we care about our sex drive, we care about, if it works, and we care about what it looks like.
100%, man. And I mean, you're a testament to the fact that it's working just fine. Because I mean, you could have told me you were 35.
Go on.
So you gotta lay it on thick, man. But no,
Right.
honestly, man, it's kind of because that's one thing my wife and I always talk about when we go out in public. We see how decrepit males are looking, and that's one of the things that I've had other people on the podcast talk about too, right? We talk about PUFAs, we talk about all the BPAs, the biphenyls, the xenoestrogens, the microplastics, all that kind of stuff, and how that's affecting, the modern
Hmm.
male.
Yeah.
And I mean, we're not doing anything about it. But in your case, obviously, you're a testament to the fact that you can do something about it. You can change it. You can be conscious about it. And you're
Yeah.
living proof of it, right?
Yeah.
And that's kind of one of the things that I'm trying to accomplish with this podcast. That, hey, we as dudes don't just have to be over the hill at 40 and just croak and commit suicide and do all these other things. Like there's light at the end of the tunnel, so to speak.
Yeah.
And, we're still going down it. It's a journey.
Yeah. And for me, the mindset is sort of live your best life.
Yeah.
You know, as long as it can be done safely, and as long as it can be done so that it looks natural and everything
Mhm.
works natural, live your life, enjoy your joy, enjoy your sexuality, enjoy all the things that you are, for as long as you can. This is really about how you want to live your life. This is about the
Mhm.
quality of your life. And I think men really connect to that because, you know, you turn 40 or 50 like I just did on the weekend, and it's not over. It doesn't have to be over. You can
Mhm.
have an awesome long life of enjoying that part for until you die.
100%, man. And it's kind of the difference between living, with vitality versus not. A
For
lot of
sure.
people, you see them just kind of drop off, and it seems like that drive is just gone. And
Yeah.
it seems like it's a combination of things like, sure, there's the physical side of things, but it's almost like that mindset also starts to corrode in the same way that the body does. I mean,
Yeah.
I'm a big guy. I'm big into holistic health, and I know mind, body, and soul. All these things are connected. When one's missing, you see it all affect everything else, right? But
Yeah.
that being said, you mentioned that the landscape of men's health, especially erectile dysfunction, has changed over the past 40 years. What's one of the biggest things that you're seeing that has changed, just in the last 10 or 20?
I just think that there's such more of a greater awareness. If you look at the statistics, it's crazy. We know that 50% of men that are over the age of 40
Mhm.
complain of erectile dysfunction to some level. And just dysfunction doesn't mean that your penis doesn't work. It just might not be as hard as it used to be. And
Yeah.
so that awareness is very, very much more present in the population. And if you ask men, it's becoming, you know, the age is becoming younger and younger and younger and younger now. People in their 30s and even late 20s are talking about differences that they notice from, I guess, the gold standard of an erection at 18 years old. And
Yeah.
so there's just more of a welcoming awareness to say, hey, this is an important part of my life. And you know, we kind of, we don't want to accept the fact that it might get softer or less hard. And, you know, and certainly we have medical options in terms of pharmaceuticals, Cialis, Viagra to be able to do it. We're seeing a trend where, you know, men are using it earlier and earlier, and while that might be good or that might be bad, I don't know. Certainly, it's there. Um, Drugs tend to be band-aids and they're not fixers, and
Yeah.
so it's really begun to drive the industry for solutions that actually can fix the problem. And so, you know, that was one of the things that I explored, and that's where I came into finding all about acoustic shockwave
Yeah.
therapy.
The gains wave.
And in Canada, the only Health Canada approved device is one called Viasure.
Interesting. And the Viasure, does it work in the same vein as the gains wave?
Yes, it's a slightly different technology. It's not sort of eh, uh, the reflectors are much larger so that they get
Mhm.
more of the penis erectile tissue all at once. So it tends to be more like a instead of a smaller paintbrush, sort of getting those
Yeah.
vessels, a little bit more of a larger roller, and so it tends to be a little bit more effective.
Interesting. Interesting. I didn't know that because I had honestly, I just learned that today. I mean, I didn't know
Yeah,
that. Most of the guests that I've had on have all been from the States, and they've all talked about the Gainswave technology.
yeah,
And
yeah,
even how you can use the Gainswave technology on the clitoris, on the penis, and all that kind of good
yeah,
stuff, right? Like
yeah.
it's pretty interesting. I'm like, wow, the fact that we're able to do this, break that plaque up and let's get this blood flowing in there.
Yeah, stimulate new blood vessels, new smooth muscle growth, and it's pretty awesome. And so, but it's cool because it's also a fix. You know, it's not like
Yes.
it's a medication that doesn't solve anything. It's actually doing something. You know, 85% of the erectile dysfunction out there is vascular. You know, thinking about the
Interesting.
same things that happen to our vessels or around our heart, where you get plaques and atherosclerosis, and it
Yeah.
coats, and so that happens in the erectile tissue of your penis. And so, you know, if you have things like high blood pressure or diabetes or high cholesterol, these things can actually make it go even, you know, 2 to 4 times faster. And so, having devices like this that actually fix it and develop more blood vessel growth is a big, big win for men.
Hmm.
Because it's non-drug, and it's certainly not painful, and it doesn't require any big surgical intervention. It's just a quick 15-minute treatment.
which is awesome. I mean, I gotta look into that because I'm like, hey man, I want to make sure I'm at that gold standard too.
Absolutely, level up or raise the bar of your erections for goodness
A
sakes.
100%, man. I'm always looking to maximize everything.
Yeah,
No, but straight up, I mean, that's one of those things that I mean, a lot of dudes, it's kind of like you're mentioning off the air, that a lot of dudes kind of have shame around this subject or view it as a taboo kind of thing. For
yeah,
myself, I mean, I'm a very upfront kind of blunt person, and I just like to learn the
yeah,
truth. So that's kind of
yeah.
liberating for me in that sense that I like, hey, I just want to find out about it. I'm curious, right? But
CJ,
now,
I think it's totally true, and I'll just interrupt you really quickly that I think that men uh, feel shame about sort of talking about their sexuality or talking about their penises or talking about issues, and maybe they mentioned it to a dude friend, but probably
mhm,
not. They mostly kind of hold it in, and I just found in my practice in my men's health clinic that when you open the door and make it comfortable for a guy to be able to and ask some questions and just to talk about it, it's almost like, they
yeah,
sigh this big sigh of relief as it's, I can talk about this. You give them freedom and liberty to be able to sort of get it off their chest and say, actually, this has been terrible. This has been bothering me, and it's
hmm,
affecting my relationships, and it's affecting my self-esteem and all that kind of stuff. Just talk about it, open up the door, you know. And so we don't. It's not a dirty thing. It's a healthy thing, and
hmm,
and to be able to feel comfortable to speak about it is really half the battle. Okay, now let's talk about
100%.
solutions, right? So,
Hmm. Yeah, no, and that was the whole purpose of this podcast. Is my curiosity was just what kind of drove me to start this, and it was everything related to men's health, and obviously, learn more about how the mind works. I've had psychologists on talk about that and how men suffer in silence. And for the most part, a lot of the time, we just kind of ball this stuff in, we go intrinsic, and even for
yeah,
myself, I'm not perfect. Like I'm still learning a whole lot about. Okay, I got to learn how to deal with this, and do that. It is a process, but the fact that we have a place where we can talk about it and talk about it openly makes it that
yeah.
much easier to actually look for the solutions, which kind of leads me to another question, the big shot. What's that all
Yes.
about?
Ooh, the big shot. Well, the big shot is really about male enhancement. And some people are like, "Oh no, no, I'm good. I'm good." I mean, honestly, CJ, any man in the history of the planet, in every culture, doesn't
Yeah.
matter when, wouldn't mind a little longer and wouldn't mind a little thicker. All right. So that desire, whether you're 3 inches, 6 inches, or 9 inches, to tell you the truth, is ubiquitous. Why is that? Well, it's because 99% of the time we're not walking around with erections. We're walking around with soft penises, and if we're a little anxious or if it's a little cold out, they get even smaller and smaller. And yet when we look down at that, well, that's not us. We really identify with our penises as being hard. And so there's that
Mhm.
differential. It's weird too, like when you go to different cultures that are more like, you know, bathing suit cultures or beach cultures, men are in a bathing suit, or maybe they're in a Speedo. That's not North American bathing suit culture, but it is in many other places of the world. And they'll kind of like flick their penises on the beach to sort of make them a little bit semi hard so that they show a little bit better. I mean, all these
Interesting.
weird sort of like things that guys do to sort of feel like, oh, this is me. This is I'm bigger than this. I'm more legitimate. Maybe it's about legitimacy. So that
Mhm.
piece is not new. And in my brain, it's the equivalent of a woman getting a breast implant.
Yep.
Like really, CJ, a woman gets a little bit more volume in her chest and they feel more beautiful, they feel more legitimate, whether they're wearing clothes or they're not wearing clothes. It's like a little volume does that for them. And you know what? It's true. And it's the same with a dude. And so really that is sort of, me saying that wanting it, thinking about it isn't new, but really what is new is how we do it. And that's really what Big Shot encompasses, sort of the best of everything. And the best of everything in my brain is something that's natural,
Mhm.
instant, reversible, but at the same time lasts a really, really long time. And Big Shot lasts up to 3 to 4 years. It's a combination of hyaluronic acid sugar, which is in our bodies. It's natural, like what, people might put in their lips to volumize their lips,
Mhm.
and platelet rich plasma, PRP, which is growth
B-shot.
factors from your
Mhm.
blood. Right. And so the growth factors, when you mix them with the hyaluronic acid, almost sort of hook onto it like a scaffold and super stimulate your own body's collagen process. And that's why it
Interesting.
lasts for so, so long. Right.
Mhm.
And so, and that's really what the big shot is really giving you that enhancement that can make a soft penis both longer and thicker, and
Mhm.
a hard penis bigger overall.
Nice, yeah.
Yeah.
'Cause that's something, I've looked into platelet-rich plasma technology and all that, and I'm like, it's not actually, I remember I looked into it because somebody was talking about actually injecting into, like, the cartilage in their knee to help them recover, and
So many
then
different uses, and that's one of them for sure. Yeah, yeah.
yeah, and what was interesting to me is just like, wait a minute, I looked into it, I'm like, the P shot for male enhancement. Sure enough, it popped up. And it's one of those things that they've talked about that, hey, a lot of doctors have their own variations, their methods, and obviously you got yours. And I imagine it's probably pretty freaking awesome, when you go get it done. And I know that technology is just going to continue to get refined over time, but
So
it's kind of,
there's a point of difference though, and I'll just say that right now. So platelet-rich plasma and is growth factors from your blood. When you inject it into the blood vessels, the erectile
mhm,
tissue, it has a potential to stimulate new blood vessels. Okay.
interesting. Okay.
So that's a different, so that would really help with erectile dysfunction. Okay. So the big shot is different. The big shot isn't about your erection. The big shot is about an enhancement. And
Whoa.
so that mixture of filler and platelet-rich plasma actually goes and fills up a potential space. It goes
Oh, okay. I
underneath the
got you.
skin
Yeah.
and on top of the erectile tissue sheath. Okay, so it fills up that potential space. So therefore, it doesn't change the sensitivity of the penis because that's in the skin. It's underneath that, and it doesn't affect your erection because it's on top of that. And so when you fill up that space, it holds your penis out, it makes it longer and thicker. Okay. And so this is a
Oh.
non surgical procedure that can be done within about 15 to 20 minutes that gives you instant length and girth without affecting your erectile ability, without affecting the sensitivity. And then when you get an erection, it's bigger on top of that. Okay. So
Wow.
that's really what it's doing. So it's quite different than the P shot, the platelet-rich plasma injection into the erectile tissue. It
Mhm.
really is quite different. It's unique in the fact that it's filling up that potential space.
Damn, man. I mean, that is it totally blows my mind because
Yeah.
when I heard about the P shot, it was totally different. Yeah, you're right.
Yeah, and so that's really, I mean, you can inject it in a circumcised penis or an uncircumcised penis, and it really, the amount of length and girth you get is dependent upon your penis.
Mhm.
But it really, we really see some dramatic differences for people who we would kind of categorize as growers, not showers, right?
Gotcha.
When they're
Yeah.
hard, they're like much bigger than they look like when they were small. Then they have all that potential space to be able to fill up, and
Interesting.
and then that's sort of,
The
we
mental
call it a
side of
big
it.
shot because it makes you feel like you're a big shot, and you have that energy.
Interesting, man. Because I mean, blew my mind. Yeah, I did not know that. And you're
Yeah.
right. That's a technology that's exclusive to you. Because from what I heard from a lot of the other people, they were doing the P shot, but they were just combining with things like pumping and nitric oxide supplements and other things.
Right. So I mean, this is something that enhance and then enhances you immediately. You're going to see it right away. And but then the piece that's unique about the big shot is that you get that longevity piece. I mean, if you go down to Beverly Hills right now, there's a number of clinics will go down and they will inject 14, 15 vials of hyaluronic acid filler like Juvederm into your penis. And the problem with that, although it's safe and natural and instant and reversible, all good things, it doesn't have that longevity factor.
Yeah. So how
Okay.
long do those ones last for then?
They last about 6 to 8 months
Oh,
maximum,
what? So
maximum,
not
and
very long.
and,
Hmm.
and if you're gonna be investing in something like that, when we think about in the category of like a breast implant,
Mhm.
then you really want it to last. I mean, you can think it's
Yeah.
great for like a month or two, but you just, laid some money down and you want to make sure that you have that longevity portion. And that's why this is so fantastic.
Interesting. Yeah, because I mean, obviously, if I got it, man, I wanted to last at least a couple of years. I don't want to think about
Of
changing it up
course.
every 8 months.
And it's tends to be a front-loaded investment, which means if it goes down about 10 to 15% per year,
Hmm.
at a year, we recommend come in for a small touch-up, and that just reinforces what you have. You can do that a year after, and then the longevity of that just goes on, and we really haven't, seen it degrade in the 10 years or so that people have been sort of, tinkering.
Yeah. Super interesting, man. And could you combine it with something like pumping or a different modality? Like,
So for sure you could in general in the initial recovery period, which is a couple of weeks after it's done. We really, really want that product to not be um, manipulated in the fact that,
mhm.
or sucked or all that kind of a thing. And so in general, for sure, after it's settled, that wouldn't be an issue. But there's almost CJ like no need to combine it with pumping after because
Interesting.
it's already been blown up as much potential as it could be.
That is crazy, man. And do you guys use the acoustic technology prior to
You
injecting
can do it you
the
can do it
shot, or?
prior to, or you can do it after, but if you're gonna do it after, I usually recommend at least a month just to let
Mhm.
everything sort of settle so there's no disruption in the product. Yeah.
That's
But they all
yeah.
combine together, like, first you wanna have a sex drive, and then that gets great, and then you wanna make sure that your penis is working well, and then you wanna take some pride and ownership
Exactly,
of
man.
of your unit and enjoy that piece.
Mhm.
And, and it's very, very healthy. It's great to feel great in your own skin. It's great to feel great if you were naked in front of 3,000 people and saying, "Hey, how you doing? It's nice to meet you," and you not to feel shame about that. It's not about exhibitionism. It's not. It's not at
Mhm.
all. But it's about feeling legitimate in who God made you to be.
100%, yeah, but, I mean, to your point, it's kinda the same reason why we go to the gym still. I mean, for myself, obviously, health, longevity, blah, 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 but at the same time, it's like, "Hey, I wanna look good naked." I wanna
Uh,
make sure I got my abs. I make sure I
for
look awesome,
sure.
right?
For sure. I mean, not that I've been to Alcoholics Anonymous, but change the things that you can change and accept the things that you can't.
Exactly.
It's a good thing. And if it's something that can be done safely and that looks natural, then live your life.
100%. But I mean, to your point, it's kind of like obviously you want to have those steps kind of lined up, but I don't see why you wouldn't want to supercharge what you got. Like, hey man, if I'm
Yeah,
gonna treat
me
my body
neither.
like a Lamborghini, then I best start acting like it, feeding it, and making sure that I can step my game up. And that's the
Yeah.
way I see it. It's in this exact same vein.
Yeah. I mean, and I mean, it's interesting too, because I mean, what do we aspire to? I mean, if you got hair, or if you're bald, there's beauty in both of them. And I think that
Hmm.
the main thing is in trying to just be your best. Be your best in everything that you do. And if that's something that was glitching you, then there's an awesome solution. And
Hmm.
if you're totally fine with it, well, then that's great too. Lucky you. That's really, really great.
No,
The
yeah,
the
the
the the the,
confidence,
the
yeah.
the confidence. I mean, the people that just, what I love is if you don't care about something, you completely remove people's power. You take away
Hmm.
their power.
Yep.
And it always glitches me because I'm like, but I care about that. How can you not care about that? But. So really, I mean, to each their own. But I mean, I just love that there's opportunity now for men who can suffer with feeling shame and feeling embarrassment and feeling not good enough to be able to do it in a way that's safe, to do
Yeah.
it in a way that actually produces something that's valuable and with low risk, which is awesome.
Dude, yeah, no, I think you're on the forefront of something big because I mean, all this technology just it's starting to make its way out into the mainstream, but it
Yeah,
really hasn't taken hold just yet.
I
And I kind of
agree.
feel like we're gonna get to the point where a lot of people are gonna start to say, "Hey, you know what? I'm tired of hiding. Like let's bring this to the
Yeah,
forefront. And just talk about it in public."
yeah. Yeah, it was interesting. I had a patient from England, and they weren't necessarily doing the big shot in England, but they were doing some sort of penis enhancement. Penis enhancement isn't new. I mean, we've been
Yeah.
trying to put fat in there, or if you go down to
Saw that. Yeah.
South America, they'll try to do like permanent things like liquid silicone or something that's
Ooh.
permanent. Risks, or there's nothing perfect about fat. I mean, 90% of it dies, and so then you could
Mhm.
get permanent lumps, and it didn't last. So this is really why the trend has been going on to things that are natural but actually last and are predictable. So I mean, this guy from England said, I'm so glad I found you. You know, like I've been looking for so long. I would just go to Harley Street in England, and I would just once a year get a little bit of a top up, and it's like, this is what I do. And he came to Canada, and like, nobody does this. I'm like, well, you found me. So you know, even there in London, England, or in certain places, men are already starting to get accustomed to saying, hey, this is a little bit of a maintenance thing for me,
Mhm.
and this is what I do to keep up and to level up and sort of maintain how I want to look and how I want to feel.
Yeah, dude, 'cause I think different cultures will approach it in a different way, but for some reason, I think in the West, it's kind of weird because like we promote all kinds of different things when it comes to sexuality, this, that, and the other. But for some reason, it's always taboo. It's like the penis. No, we're gonna talk about that. Breasts are
Yeah,
okay, vagina's okay, but no, no, we don't. The penis that's a bad one. It's almost like it's extra. I don't know, something intimidating about it. I don't know, but it's one of those things that we just always kind of shun to the side. And if
yeah,
somebody's got like erectile issues or if he's small, you just tell him, "Oh, just deal with it," right? And it's
right.
kind of like, we don't ever let these dudes actually explore their options. We just kind of like stop them and we say, "Oh no,
Yeah,
anything related to male enhancement, that's a scam."
right. And yet, you know, like, you know, pumps and different and weights and stuff like that, they've actually been around a
Oh
long
yeah.
time. They've been around a long time to try to, you know, think of sort of solutions that you can do it. So it's like I say, it's not new. I mean, I was in Rome. We went to Italy last summer, and we took the family, and we went to Pompeii, which is that ancient city that got instantly,
Yeah.
you know, like annihilated with Mount Vesuvius when it
There's
blew like 2,000
the
years ago.
volcano,
That
yeah.
volcano, and it was frozen in time, and they're digging it out slowly, and it's so awesome because, you know, you can see this little glimpse into their culture. And of course, in Pompeii, they had the cult of the penis. And
Yeah,
etched
I know.
into the stone, they have, you know, figures of penis pointing the way to the brothels, or they would actually have temples where they would actually, I guess, worship it. I don't know, but you know, it's not like it's not like it's new, you know.
Yeah.
And so in different seasons and different times, you know, a little bit more open to be able to talk about stuff like that and contextualize it. You know, in my brain, talking about it is good and is healthy because it all needs to be, you know, put into balance of who we are and how we use this, and what are the rules around it, and all those things
Mhm.
are really, really important. But to be able to celebrate who we are and to be able to be proud of who we are, it's actually very powerful.
I think so, and I honestly, to the whole confidence piece, like for myself, I kicked it old school, man. I did weights, manual exercise. Like I had a little bit of success with the manual side of things, and that just spurred me into this, like going balls deep into
Yeah,
this subject. And then now I'm like, the technology is evolving to the point where a guy doesn't necessarily have to go down the same road I did. There's
yeah.
a whole bunch of different modalities of science there. It's more accepted, and I think it's something that's just going to keep evolving. That's kind of
It's
why
gonna
I
blow up.
enjoy.
It's true. I
Yeah.
totally agree with you. It's going to blow up, and you know, it's also interesting because Toronto actually has, where I'm from, it has a pretty cool history. One of the guys that really propagated and advanced some of the penis technologies actually was in here in Yorkville, where we are, and his name was Dr. Stubbs. And Dr. Stubbs was doing lengthening procedures by cutting the suspensory ligament of the penis,
Okay, yeah, I've heard of that. Yeah.
and that was sort of a ligament that anchors sort of the erectile tissue onto the pelvic bone, and when
Mhm.
you cut it, it kind of allowed the penis to sort of sit forward a little bit more. It was problematic, and it's in general sort of been thrown out because you get a lot of scar tissue. It would contract, it would make your penis smaller, or if it
Yes.
did work, your erection would go kind of like straight down in between your legs, which obviously would be a little bit awkward.
To say the
So,
least.
let's just say the least. So, I mean, there were issues. I mean, but there's been a quite a grand history of ways to sort of do it that makes sense, and so many of them sort of have been tossed out because they either didn't work so well or they had a high complication rate. I mean, I literally just saw a guy a couple months ago, and he had like pig cartilage put into his shaft to try to like, it was bizarre. I'm like, pig cartilage, what are you talking about? So I don't even know where he had that done. There's also a new technology out that's being bandied about called Pneuma, and
Mhm.
it is an implant. It's almost like a sheath or a piece of like thick plastic that goes around the shaft and sort of
Oh, okay.
acts as a strut so that it can't shrink back, gives you a little bit of length and girth, and of course is permanent. And so they have a group of people that are trained and physicians that are trained to be able to do it. And in my brain right now, implantation right now in the penis has been classically fraught with
Mhm.
infection, and although permanent is always great, infection is not great, and if you do get infection, it's kind of a big deal. And so in my mind, having something that's healthy, or sorry, natural and reversible and safe with super low infection rate now, not one's creeping up, to 25-30%, sort of is
Mhm.
the way to stay, at least for now.
Yeah, no, and I mean, obviously, you know what? Sometimes we got to explore different modalities and we got to figure this stuff out. And that's kind of where medicine kind of comes in. And that's where doctors
For
kind of,
sure.
hey, man, we got to try some out. Like, I remember reading about Bayardo Fisher, I think the doctor from Brazil. And I think he was the one that was experimenting on his cousin. He would sever his suspensory ligament along with, I think over time, just kind of like, I don't know what he was doing, but he basically was able to get it to double in size almost or something. Granted, I
Yeah.
mean, it was in the Guinness World Book of Records, but I didn't find enough of the
Benefit.
records. Yeah, and I'm like, well, there's also that. I mean, scar tissue and all that. I'm like, God only knows how his Frank and Dick worked overtime. Like
Yeah.
because it was
Well,
all botched up.
and that's the thing, so safety is a big thing, like where there's definitely a motivation and a drive to be able to want to do these things, but are we doing them safely? And
Hmm.
and if you do like it for this week, maybe you don't. I mean, I've had situations where I've had a dude come in, we gave him a very nice natural but large enhancement. He thought it was fantastic, and he went home and his wife just decimated him. Why would you do that? I like you without this. This is so stupid. And that got to him too. And he's like, you know what? I really like this, but I got to be married and I got to have this. And okay. So here's a scenario where he liked it and was about him, but still you have to be able to play it in context to your life and the people in your
Hmm.
life and the people that are privy to see it or use it.
Yeah.
And so we were able to bring it down for him and to be able to dissolve it with an enzyme called hyaluronidase. So for me, the
Interesting.
enhancements in this way with Big Shot is nice because you can get something, you know, stunning and remarkable. I mean, for me, this is penis art, CJ. This is really
Yeah.
making a beautiful penis that looks, very aesthetic when it's soft or when it's hard. But I mean, it's also in context to saying people can change their mind. People want safety,
Hmm.
and is there an out? Is there an easy way to reverse? And I think that's the amazing thing about it as well.
Yeah. And I mean, from what you're telling me too, it's like the other big thing for myself is just like, okay, does it function properly when everything's said and done? That's
Yeah,
that's a key
yeah.
factor, I think.
Well, of course, what's the point, right? We want it to work well. We want it to look good, and we don't want people to go, oh, what's that? That's weird. And at the
Mhm.
same time, we don't want weirdness about it. So, as people become more and more interested and more aware of these kinds of things, it will continue to drive the industry to more natural, to more um, you know so that it looks normal, because I mean we can create burritos for sure, but they don't look fantastic. Well, they don't look real.
Yeah, no, I totally get what you mean because it's kind of like if you're lacking that aesthetic factor too. Honestly, if I got that done and it's like I look down and it looks like the Michelin Man is, I don't know,
Yeah,
like just lipped up and looking all weird and swollen and disgusting. I don't think my wife's gonna be privy to that either. She's probably look at that and be like, "Oh, that is disgusting. What'd you do to yourself?" And I'll be like,
for
"Ah,
sure.
it's bigger though." And it's like,
Right.
"Well, I don't, it doesn't really look that great."
That's true. And I mean, from a male female perspective, men are much more, driven visually, and probably appreciate their junk more than a woman does. Like
Hmm.
the women aren't necessarily as visual and cued into that piece. And, not every woman, obviously, but a good majority of them.
Yeah, I mean, it's definitely something that is far more relevant to us dudes, and we're the ones doing the comparing and
For
all that
sure.
good stuff. But
For sure.
the other question I wanted to ask in regards to the big shot was how long does it usually take for you to heal up after everything's been said and done? Is it you're good to go
Yeah.
right after or
Yeah, so it's a great question. So because in the mixture there's a good proportion of hyaluronic acid. Hyaluronic acid is a sugar, kind of protein sugar, that's in our skin, in our eyeball fluid, in our knee joints,
Mhm.
and really the function of hyaluronic acid is to attract water. So it loves water. And just think
Mhm.
about, when your wife goes and gets her lips done, they swell up for a few days after, because that product sucks up water, holds onto it for a couple of days, and then slowly lets it go. And then it will feel like soft again. And the same thing obviously was going to happen if you're injecting some volume of that into your penis. It swells up. So a good 6 to 8 hours, it's already starting to draw water to itself.
Mhm.
And, generally we say sort of lay off it. The bulk of the swelling is going to happen for the first 3 days, and then will really start to dissipate and soften. And so we'd recommend that you sort of lay off any sexual activity for about 3 days. And it'll feel a bit tender, and it'll feel a bit, um, you know, stiff, just because it's swollen. But, pain is something that's not. Um, Really a big part of it. I don't really feel like, it would be necessary to give a narcotic for it. You might just take some extra strength Tylenol and
Mhm.
lay on your back. But in general, you could resume activity, working out, going to work, doing all that kind of stuff. You just feel like you'd be a little bit sore and a little bit swollen, but certainly not that anybody was going to like notice, visually. You
Mhm.
could do your thing at work and all that kind of stuff.
Gotcha. So basically take a couple of days off, just rest, recover, all that. You don't have to ice it or anything. You're just
No, 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 in general. And some people say, oh, okay, should I wrap it? Should I use the pump and all that? No, sometimes I'll have them, kind of roll it, as that product is a little bit manipulatable in the first few days, just sort of making sure that everything's smooth and even. We get them to sort of do that for a few days, but after that, it's pretty much sort of settled.
interesting. I mean, like you said, the natural treatments are always better. And for that reason alone, I mean, I guess the natural healing just kind of, because
Yeah,
3 days is pretty quick. That's relatively fast from everything that
yeah.
else that I've kind of looked into.
And predictable, and we want predictability. I want something that sort of does what I have planned it to do. So
Hmm.
predictability is a good thing. Like if I was injecting fat in the penis and I knew that, that 90% of it's going to die, how do I know what the 10% is going to live here, 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 or here?
Yeah.
You just don't know. And so it's nice to be able to have it saying it's predictable in this way.
Interesting. And has there been times where there have been complications where you're like, okay, let me just manipulate it a little bit more, or have to get it to make sure you got to shape it out almost? Because, like you said, you're almost like a sculptor with it, right?
Yeah, for sure. I mean, while the complication rates and risks are extremely low, with anything, you can always have a complication. I think there's about a 1% risk of having an infection.
Hmm.
And although it's very low, I still will always treat with a 5-day course of antibiotics that are sort of what we call prophylaxis as a just in case.
Hmm.
And certainly infections can be easily treated. Um, irregularities, like if someone has most dudes have a regular bend in their penis,
Yeah.
it's called Peyronie's, and
Yeah.
there's usually some scar tissue. There are treatments from that with that same Visor machine that I was talking about can actually
Interesting.
treat Peyronie's, but generally I'll just correct for that little bend by making the girth so much thicker that it just sits central. And so that means on the bend side, the curved side, I'm going to inject a little bit differently than the other side. And so I always like in my practice to have patients come back 2 weeks later. I make it as even as possible. Let's see how it's settled. All right.
Yeah.
And then for that second little tweak day that we inject when they come back for the second time, it's really, really more about being a penis artist, a little bit here, a little bit here, and a little bit here. And to make it as aesthetic and even as possible. So that's in general sort of the kinds of things, asymmetries, um, things flow really, really nicely. And I like to be able to see and have it come back so I have really good quality control. Because
Interesting.
when you see it, you'll start to obsess. Well, I like it. I like it when it's hard, but then I see it this little bit different, so you want to put out a good product.
No, but that's 100% true, man. Because obviously the dude wants to be satisfied, but more importantly, you want to be satisfied with your work and just know that it's like, all right, perfect. It's got that
Yeah,
seal of
yeah.
approval.
Yeah, absolutely. If I'm branding something, consistency is really, really important, and it also establishes trust. And then I know that they're going to come back in a year for the little micro touch up. They're going to be happy to do it because I tell you, once it's a certain size, you will not want to tolerate any degradation in it.
Yeah.
And so you sort of keeping and looking at it, and then it's a front loaded investment. The more you do at the beginning, the longer it lasts.
Yeah. And what was the other question that I just had right now? Would you recommend it for somebody that has erectile difficulties at the onset, or would you rather get them started on some type of therapy or doing something first and then be like, hey, let's not worry about the male enhancement until you figure this out?
Yeah, I mean, oftentimes I'll see men come in and they kind of like are excited about all of those things. So which one should we do first? And
Hmm.
so, sometimes sometimes erectile dysfunction isn't really erectile dysfunction. I mean, and now we're going to dive into something a little bit deeper. There's lots of reasons to have erectile dysfunction, and some of it truly, truly is organic, but a lot of it is psychological or even
Hmm.
deeper. It's always when I sort of have my porn talks with my
Yeah.
patients, and porn is pretty rampant
Hmm.
um, nowadays with men and women, but particularly men. It's just so available, and I'm just going to make a statement that porn is good for nobody. It's
Hmm.
really, really not good for women in many, many ways, but it's not good sexually for men too, because it really sets the bar to something that's unattainable. And
Hmm.
so, men often will use porn when they're by themselves and can't, do anything by themselves if they're not using it. And then when they're having partner sex, really aren't able to go there anyway. So it really, really sets things so askew. And
Yeah.
so lots of men come in and say, well, I have erectile dysfunction. And I said, are you sort of like using porn all the time? And they're like, every day, all day, kind of a thing.
Hmm.
And I'm like, okay, well, like that here's something like you can get an erection, but there's so much subterfuge with regards to because so much of it is up here, isn't it?
Yeah.
And how we think. And so being able to offer solutions, we have a great resources at our clinic where we really, really talk about it. I mean, it's just even talking about it right now, you're like, okay, well, I can totally see that. And
Hmm.
I kind of know that it's not healthy to be doing this, and yet
Hmm.
it's sometimes really, really hard to stop and all that kind of stuff, and yet it can affect every little piece of your sexual life and your sexual
100%.
relationships
Yeah.
and all that kind of thing. And so being able to talk about that and say, hey, what are the solutions? We have some really good treatment um, pathways in our clinic and in our website that we offer with regards to that. And so to answer your question, yeah, we talk about stuff like that. And so if it's truly organic, then we can go to stuff like Viasure. But if it isn't, I want to talk about that.
Yeah.
Um, so it kind of goes like that.
No, but the thing is, for me, I've had a bunch of different guests talk about it too. Like Dr. Tara, she's a sexologist in LA, and I had her on. She was talking about how she's seeing men as young as 18 unable to get and sustain an erection with a real
Yeah,
human being because
right.
they've been so just blitzed with nonstop porn to the point where their
Yeah,
receptors and the way the brain works, it's
yeah.
actually been reframed. And it's like, hey, man, you know what? I'm used to my dopamine hit from a screen. I can't even get hard for the chick that's lying in front of me. You know, it's
Exactly.
insane.
Exactly. And so, you know, like, so where do we start first? I know that was your question. You know, do we start with this or do we start with that? In general, I'm going to target the things that bothering them the most. You know,
Mhm.
if it's having an erection is what's the cause of that? But sometimes it's because of low testosterone. I mean, if you're in your 40s and your 50s and you're having a hard
Yeah.
time to get erection, let's look at your testosterone. What does that look like? Whoa, let's test it. It's so low. All of a sudden, we bring it up. All of a sudden, you have a better sex drive. And when you have a better sex drive, then you have better erections. And so all of a sudden, the testosterone replacement therapy was able to really target that erectile dysfunction because you just didn't have a sex drive to begin with, right? And
Interesting.
so let's
Yeah.
start there. Or and so generally we want to go with what's bothering you the most. There's some guys with, you know, coming in and they're saying I have a hard time with erectile dysfunction, but the first thing that they want to do is the big shot.
Mhm.
And then all of a sudden we do the big shot and they don't complain of their erections anymore. Well, how did that work? This was about confidence.
Yeah.
This was about them feeling good in their own skin. And when you're so glitched out about your anatomy and how not good you are, when you're able to inject a little bit of hope and a little bit of dignity and a little bit of legitimacy to a dude, all of a sudden they feel taller. All of a sudden they feel like they're, you know, they want to start getting back to who they are, and that's powerful.
Dude,
You know,
yeah.
so you know, like I say, you know, it's deep to talk about this kind of thing because it's not really just about, you know, a penis or, you know, or about sex. It's so much about how we work into how we feel about ourselves as a man.
Yeah, no, because the thing is, I don't think there's anything that could be more dehumanizing as a dude is like being unable to attain an erection or getting a
Yeah.
lackluster erection, because then you just feel like less of a man. It's emasculating.
Yeah, and it gets into your brain, and then you're worried about the next time, and then you're worried about the next time, and you do all
Yeah.
these weird things to try to have it, right? And it gets worse as you get older too.
There is that piece, and I mean, a lot of to me, it's kind of a combination. But what I really like about your approach, Dr. Torgerson, is the fact that you're not just you're paying attention to all the different factors, which is something that I feel has always been missing in modern medicine. A lot of people would be
Yeah,
like, "Hey, just boom, take this. Hey, do that."
it's
In
just
your
a pill.
case,
It's just a this or that. Yeah,
exactly, but you're looking at it from like, okay, what's going on with this guy psychologically? And the fact that you nailed it on the head with like, are you watching too much porn? Because it's out there, but that's another subject that a lot of people just don't want to talk about. But porn addiction, in my opinion, I mean, I've tried in my day, back in my day, you know, I tried cocaine, you know, I love cigarettes. I don't smoke anymore, but I love cigarettes, all that kind of stuff, right? Porn was way harder for me to let go of than any of those things, whether it was alcohol, any of those other vices, just because it was everywhere all the time, easily accessible. It's not like I can just, you know, get up in my house and be like, you know what, I feel like drinking a 2 6 of vodka today. I got to go to the store and literally go get it, you know?
right, right.
So
Yeah, it's crazy, right? It's different nowadays, and I think we're really going to see the next generation be much more hung up on issues related to porn, and so I feel like and in sexuality as well. Maybe, you know, we'll talk about it a lot more, but it'll definitely be a bigger part of the picture, and so yeah, I think we need to have voices to advocate to say, hey, you know, it's available, but this is not a good thing. This is
mhm.
not healthy. This is not beneficial.
Well, you know what the thing is about porn is it's just so fake and it really skews the expectations of the men and the woman because a lot of women are
Both.
now expecting like, hey man, this guy should last for 45 minutes, blah
Yeah.
blah blah, and the guy's like, yeah, I want to bust my nut in her face, and it's like, you talk to most women and they're just like, "Nah, I'm not into that. It's a Tuesday night and I'm not looking to get thrown around the house and then have a guy come
Yeah,
all over." Like, no, it's just this stuff is all made up. It's a fantasy, right? And I guess there's people that can categorize it and just be like, "Hey, you know what? This is a one-time kind of thing and whatever." However, for a lot of the young boys who's like, I mean, the mind of a male, if I'm not mistaken, is not even done being developed until you're 25. And if you're watching porn every day up until you're 25, you've basically rewired your neurocircuitry to approach the world, well, from a sexual standpoint anyway, in a way that doesn't make any sense. Like it's not
yeah,
real, but you've
yeah,
seen it so much and you've actually created this new circuitry in the brain where you're like, this is the way I work and I can't
right.
get hard without my porn.
Yeah, and then where does that go when you do get into a decent relationship or a long-lasting relationship, and when you have children and all these kinds of things, when your brain starts to think differently and you start to think generational and you think about the future and all that kind of thing, and
Mhm.
how we think about our daughters and our sons and all that kind of stuff, like it is a rewiring and it is and it's a big part of it. And so this is why I said talking about it is so important, because it talks about, healthy boundaries
Mhm.
and like it's awesome to be able to have a healthy sexual identity, but also to have a healthy sex life and a
Mhm.
sustainable one that's life-giving, not only for you, but also to your partner. And it has this awesome, trickle down effect that where the boundaries are respected and then it's something that is so enjoyable and so good.
Exactly. And I mean, hey man, props to you because you're doing it, man. And I love the approach that you have to it, right? Because it's not just like, hey, fix you up, boom. But let's not even explore the fact that, hey, psychologically you're damaged. You got these things,
Yeah,
you got
exactly.
these things on point, man. And I love that because you're not siloing off these different things. And obviously
Yeah,
it's kind of like the male enhancement piece is almost like the cherry on top. And like
yeah,
you said earlier, it's nothing new. There's nothing
not
new
new,
under the sun at all,
not new.
right? But
Yeah,
it's kinda
it's
like
true.
mastery of all these other things, and with the technology that you bring, I mean, I'm loving the approach, man.
Yeah, well, in general, go big or go home. So,
Mhm. Do it from a
yeah.
complete standpoint. And one last thing I wanted to just touch on before we left today was, the TRT and HRT kinda component. How do you
Mhm.
go about vetting people for this? Do you just, do you have a certain markers that you pay attention to? And
Yeah, for sure. So, it requires, there's definitely more medical and, requires, a really comprehensive, interview and consultation about your past medical history and
Mhm,
all the things that your symptoms are and some of the risks and complications that need to be discussed and ruled out. But in general, we're looking for several things. Your bound or your free testosterone, your estradiol levels, see where they're coming in at, and then some of the other markers. And we look at human growth hormone, something called IGF,
mhm,
and we'll
IGF
do it.
1.
We'll measure your red blood cell count and the big complete blood cell count panel to see sort of, because if guys that are juicing for long periods of
Mhm,
time,
yeah.
their red blood cell count and hemoglobins go way up, and the risk is that it makes your blood clotty and coagulable, and obviously heart attack, stroke. And so we want to be able to do something that's, again, safe and natural. Safe means that we are optimizing a guy up to the high end of the normal range, but normal is high end of the normal range is still normal. Remember that. All
Mhm,
right, it's still normal, and so normal is normal, and that's safe. And then just to be able to, see someone and follow up and see somebody, to be able to do multiple blood work tests throughout the year to make sure that the dosing that we're giving them is appropriate and it's not affecting other stuff. Talk a little bit about prostate health and how testosterone can interact with that. And then also stuff to preserve someone's ability to do the other things that our testicles do, isn't just to make testosterone, but making sperm and a good chunk of our ejaculate as well. All these things are extremely important for
mhm.
males. So HCG is also an important component, because we're not really thinking about testosterone replacement therapy as a cycle. This is sort of like an optimization that keeps a man solid and steady in perpetuity for until maybe something better comes around or until they die. You look at somebody like, Sylvester Stallone, right?
Yeah, I
Like,
mean,
you know,
he's
he's
been big
he's
on it for
he's
years.
he's been on it for years, and there's a lot of new evidence, a lot of new studies coming out, lauding and really celebrating the benefits of testosterone replacement therapy, even including a study that came out a couple of years ago, which showed increased longevity. You actually live longer if you're optimized, which is pretty
Interesting.
cool.
Yeah, I'd say so. I mean, to say the least. I mean, why would you want to live as long as possible?
I'll tell you, forever.
As long as we can, man.
Yeah.
Dr. Corey, I still got a million more questions I could probably ask you, but I'm going to be respectful of your time. And I just want to ask you one last time, where can our followers find you? Tell us more, all your social media links, all that good stuff. And I'll include it. I'll include it in the description too. But
Yeah, absolutely. You can find me lots of different ways. You can find all about Big Shot at thebigshot.com, thebigshot.com. You can find me on sovereignmale.com, sovereign male, and sovereignmd.com. We have them on multiple different platforms, but the first two are probably the biggest way that you can quickly find all about the services that are male oriented, and find out about befores and afters, and a lot more information about what we've been talking about. Thank you so much.
no, thank you, man. The honor is honestly the privilege of having you on. It's been spectacular. I've learned so much. Honestly, I told my wife I was looking forward to this interview all week. So you did not
Awesome.
disappoint, man. You did not disappoint. But
Awesome.
it was an absolute pleasure. And hopefully, I look forward to having you again in the future to just learn more, man. Pick your brain.
Perfect, CJ. Thanks so much. Have an awesome day.
Hey, you too, brother. Take care.